This is Bob. Bob is biologically defined as a male, which is a gender that has been assigned to him. But growing up, Bob realizes that he does not feel comfortable being recognized as a male in society. Also, he doesn't feel comfortable with his body and the gender roles which are assigned to him. After consulting with a psychiatrist, he recognized that he is living with a condition called gender dysphoria. Let's learn more about this. Gender dysphoria has its own chapter in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, commonly known as the DSM-5. It involves a conflict between people's physical or assigned gender and the gender with which they identify. Let's first clarify what the terms gender, assigned gender, and gender dysphoria are. Gender denotes the public and usually legally recognized lived role. Biological factors combined with social and psychological factors contribute to gender development. Assigned gender refers to a person's initial assignment as male or female at birth. It is based on anatomy and other visible physical sex characteristics. Gender dysphoria is a term which refers to an individual's discontentment with their assigned gender. People with gender dysphoria may be very uncomfortable with the gender they were assigned, sometimes described as being uncomfortable with their body or with the expected roles of their assigned gender. This gender conflict affects people in different ways. It can change the way a person wants to express their gender through behavior, choice of dress, and self-image. Some people may cross-dress, some may want to socially transition, while others may want to medically transition with sex change surgery or hormone treatment. If a psychiatrist determines that a patient has at least 2 of the following characteristics for at least 6 months, they can diagnose the patient with gender dysphoria. Foremost, there must be a marked incongruence between one's experienced or expressed gender and primary or secondary sex characteristics. There must be a strong desire to be rid of one's primary and or secondary sex characteristics, a strong desire for the primary or secondary sex characteristics of the other gender, a strong desire to be of the other gender, a strong desire to be treated as the other gender, or a strong conviction that one has the typical feelings and reactions of the other gender. Treatment options for gender dysphoria include counseling, cross-sex hormones, puberty suppression, and gender reassignment surgery. For many children, these feelings do not continue into adolescence and adulthood. While some children express feelings and behaviors relating to gender dysphoria at the age of 4 or younger, many may not express feelings or behaviors until puberty or much later. However, in general, a child's treatment typically involves a multidisciplinary team of healthcare professionals, which may include a pediatrician, a psychiatrist, a pediatric endocrinologist who specializes in hormone conditions in children, and an advocate. Treatment may focus primarily on affirming psychological support, understanding feelings and coping with distress, and giving children a safe space to articulate their feelings. It is important to note that gender dysphoria is not the same as gender nonconformity. Gender nonconformity is not in itself a mental disorder. The critical element of gender dysphoria is the presence of clinically significant distress associated with the condition. The Sexual and Gender Identity Disorders Work Group was concerned that removing gender dysphoria as a psychiatric diagnosis from the DSM-5 would jeopardize access to care. Replacing the condition's former name of gender disorder with dysphoria in a diagnostic label is more appropriate with clinical sexology terminology, and it also removes the connotation that someone is disordered. Ultimately, the changes regarding gender dysphoria in the DSM-5 respect the individuals identified by offering a diagnostic name that is more appropriate to the symptoms and behaviors they experience without jeopardizing their access to effective treatment options. With all of these support groups and the available treatments, Bob can finally feel content about his emotions and thought processes and live life how he deserves.